Welcome back to FCAC Tailgate on the HAN Network. I'm Kate Chaplinsky, and we're live at Darien High today. And I'm joined right now by Dr. Sam Taylor, who's from the Hospital for Special Surgery Outpatient Center, who is the sponsor of today's game. And we're so excited to welcome you, Dr. Taylor. Thanks for coming.
Thank you very much for having me.
Now, before we get into sports injuries, I hear that you have a very personal connection to maybe this game. I mean, Darien and Greenwich facing off. Tell me a little bit about that.
It's a huge rivalry, and I'm really excited to be here. I was actually just saying before I got here, talking with my dad, that I think probably the last time I was here at Darien High School was 20 years ago when I was a senior at Greenwich High.
And you were playing.
I was playing, yes.
And now, so football and sports in general is an important part of your life, right?
Yes, I mean, team sports in general, specifically football, has been a huge part of my life growing up and kind of helped me kind of become who I am today.
So let's talk a little bit about sports injuries. What are some of the most common that young athletes encounter?
Well, so, obviously right now a hot topic in the media is concussion stuff, and we can talk about that a little bit going forward. But certainly, some of the other big injuries that we see both in football and other sports, such as soccer, basketball, et cetera, ACL injuries, shoulder dislocations. Those are kind of two of the more common more serious injuries that we see.
Right. And now, when it comes to, an impact or an injury that happens, when's the right time to go see a specialist and go see someone about that instead of putting it off?
So that's a tough and tricky question, but in general, most of the schools around here are pretty fortunate in that they have really good training staff, a number of team physicians that are associated with these teams to help give them guidance when injuries occur. But in general, kind of signs that you should seek additional help, or if you have difficulty bearing weight or walking on a lower extremity injury, and basically kind of pain and swelling that doesn't go away.
Right. And now, what about athletes getting back on the field safely after an injury? What are some of the things you offer at the Hospital for Special Surgery that can help that process?
Well, I think that one of the most important things that comes with the treatment process is actually making sure that you get the right diagnosis. And so, for everybody involved in the care of athletes, one of the most important and the first things that we do is to try and figure out exactly what is wrong with that player. And once you establish what the correct diagnosis is, that allows you to then advance the treatment.
And so, Dr. Taylor, what do you suggest for some athletes in just avoiding some of the most common injuries? Are there any tips?
Sure. So, a couple of things. One is make sure that you're in good shape, in good condition, because in general, the majority of injuries, certainly non-contact injuries, meaning injuries that occur as a player shifts or cuts in space as opposed to being impacted by another player, are related to muscle strength, balance, and conditioning. And so much like the knee injury that often occurs on the last ski run of the day, in football and soccer and other sports, injuries kind of tend to occur more often when people are fatigued. So to be in better shape is really important.
And now I have to ask this before we go, but you work with the New York Giants, yes?
Indeed. We got a big game tomorrow, a rematch, so hopefully we can stick it to the skins.
Very cool. Well, Dr. Taylor, thank you so much for talking with us today. So appreciate it.
All right, thank you very much for having me.
All right, Dr. Sam Taylor of the Hospital for Special Surgery Outpatient Center, the sponsor of today's broadcast.